Thank you, Mr. Chairman, and thank you for being here. And we really do appreciate your hard work. You've got a big job to do. I hear a lot from Arkansas businesses that have perhaps 75 employees. Their concern is competing with a business that has 49. One group, is under the mandates, increased cost. The other is doesn't have those costs. That makes for a difficult situation. And again, as America, Arkansas, Kansas, wherever is made up of those kind of so I guess what I tell them. The other thing is, isn't that an incentive for those that are a little over the 49 to downsize? And then again, the question I would ask is, what do we tell those employers that are losing hours or perhaps losing jobs as a result of that?
Well, Senator, I know that I have heard those same concerns expressed by folks, and again, heard over and over again the snapshot of what is the current market prior to the Affordable Care Act being implemented, which is that small business owners are paying about 20% more than their large competitors for exactly the same benefit package. What we know is about 94% of employers who have 50 or more employees are offering health coverage, much because it's the best recruitment and retention package they can have for their employees, but they still lose employees to the big guys who have more leverage in the marketplace. So I think the law is attempting to capture what the snapshot of the market was and to put together a larger negotiated pool of benefits so small employers can finally have the leverage that some of their large competitors have enjoyed for years. What we saw in Massachusetts, which is the only state with a fully functional marketplace that's been in place, was a lot of the same business fears were expressed before they got up and running. They have a similar employer responsibility provision, a similar penalty, and the fear that was expressed was lots of employers would just drop coverage, drop out of the market. What has happened is just the opposite. More employers right now in Massachusetts offer coverage than before. The small market has actually increased. And so we are hopeful that with affordable comparative rates, with competitive choices in a SHOP plan, that those small employers who have told folks for years that that was a critical bottom line issue will now have some choices to make for their employees.
No, and again, I'd like to see, kind of the white paper that the research or your data, to back that up. You've got
Sure.
a situation with Washington State that is, thinking about shifting a lot of employees into the exchange. Is that something that you intended? Evidently, when
in Washington State?
Yes. Considering moving some state employees into the healthcare exchanges, this will shift healthcare costs from the state to the federal government. If others follow suit, this could cost the federal government billions. That's what the AP is reporting. So that's something you need to look into if you're not aware of.
Well, that's certainly something we'll look into. I've had many communications with the new governor of Washington State, and I'm unaware of any conversation or decision.
Well, let me read the first. This is an AP article. In a move, this is Olympia, Washington, a move that would capitalize on provisions under President Obama's health care law, but could cost the federal government millions of dollars. Washington State lawmakers have found a creative way to pass a large chunk of their health care expenditures along to Washington, D.C. Analysts say others are likely to follow suit. So again, that's something that is being considered. Evidently, as they do their white papers, their analysis, they're finding, that it's perhaps to their advantage to do as the employers with a little bit higher, the 51 as opposed to the 49. My last question is that the president said the health care law would bring down premiums by $2,500 for the typical family. What year can Arkansas families expect to see that savings?
Well, Senator, what we're seeing prior to the full implementation is actually one of the slowest growth trends over the last 3 years in private benefits, and I think that's due to a couple of things. It's due to more rigorous insurance commissioner oversight, and a lot of commissioners both asked for and got new authorities from their legislature, hired actuaries, and are doing much more intensive rate reviews at the commissioner level. We have in place, thanks to the law, the so-called 80-20 rule, where companies for the first time have to make sure that 80% of their dollars collected are for health-related costs, not for overhead costs. And we saw last year about $2 billion sent back to consumers around the country. So some of those Arkansas families got checks last year to lower their benefit costs because their companies didn't meet that ratio. And the third step will be in the new marketplaces, for the first time ever, having competitive choices available to families, and if you are below 400% of poverty, the ability to get an accelerated tax credit as an assistant to purchase that without the overhead and administrative costs that a lot of companies added on. So all told, and it wasn't President Obama, it was really the Congressional Budget Office who looked at that implementation, looked at that, both what competition can do, what transparency can do, what the new rules could do, and what the subsidy would do for families, and made that $2,500 estimate. But as you know, the markets aren't up and running. That will be next year, and we'll report back to the committee.
Thank you, Mr. Chairman.